right, Dr. Williams, thank you so much again for joining us.
Thank you for inviting me.
It would be helpful to have the audience get a sense of who you are and the work that you do. So, to start things off, we know that you're a physician. Why is voting rights and voter registration an important part of your work as a medical doctor?
Yes, good morning. I'm Brenda Williams. I am a physician in family practice here in Sumter, South Carolina. I have been in practice for 41 years here in Sumter. We moved from Georgia. And my husband and I work cohesively in so many ways. We've been married 48 years, 48, matter of fact, as of June 14th of this year. And we've been in medical practice together. We had a private practice of medicine that we started in June of 1982 and retired that practice in November of 2014. And he went on staff at our hospital as a hospitalist, and then I spent a good bit of time in the community. We have a 501c3 nonprofit charitable organization, the Family Unit Incorporated. Having said all of that, our medical practice, we saw thousands of people. I guess in the 32 and a half years we were in private practice, we must have seen about 60,000 to 65,000 people, the vast majority of whom were African American people of lower income. We saw some higher income people, but very few. And in essence, we have found that being impoverished was a key problem um, to our patients, the vast majority of whom are of lower income and live in impoverished substandard housing. In order to find out what people need more than a pill or prescription, or listen to their heart and lungs with a stethoscope, their need is much, much more. We have always been interested in people as human beings, not as objects. We've gone out into the communities of our patients. As a matter of fact, I've done a couple of documentaries, just my youngest daughter and I, that date back about 18 years, talking about impoverished people. They have more disease as far as high blood pressure, diabetes, heart disease, chronic lung disease, breast cancer, lung cancer, etc. And these problems, particularly, were focused on not just the fact that they were not able to pay for prescriptions, but where they live, uh, the housing, holes in the ceiling, walls, floors caving in, uh, inhaling fumes that come from trains that are running through their community, uh, train systems. And so we found that in order to take care of these patients, we have to be cognizant of where they live, where do they work. If they don't work, why don't they work? Do they vote? Uh, yes or no? Do they find a reason to vote? Do they understand why voting is important? So I said all of that to say this. Our medical practice went far beyond the stethoscope and a prescription pad. We delved into and continue to delve into the problems of people who live in poverty and despair.
Thank you so much. And in that answer, I think you touched on so many of the factors that shape people's health, like housing, like poverty. And I'm wondering if you could speak specifically to voter registration and voting access of why that is important to someone's health.
Absolutely. It is true. Excuse me. It is true now as it has been in the past. I'm sorry. Excuse me. Uh, when one has a sense of high self esteem, a sense of self worth, a sense of self, uh, just being respected. Excuse me, I'm gonna get a little slip here. Being respected as human beings means a whole lot. It means whether or not this person feels that he or she belongs. If you have no feeling of belonging to someone, to a community, if your voice is not respected, if your voice is heard but not listened to, all of those factors have credence when you talk about health care. And so when oftentimes we see people who come in for various and sundry reasons, usually they are low income, usually they live in low income communities, and we as physicians have found over the many years. Now, we were in private practice, I mentioned, since 82. So we stayed in private practice for 32 and a half years before we retired that practice 9 years ago. Uh, we had free clinics that we set up in addition to our private practice. And we always ask our patients, after we examine them, get the blood pressure, pulse, examine them, figure out what we need to do, x-rays, lab work, etc. We'll ask the question, are you a registered voter? And if the answer is no, we'll explain to that person why voting is important. We'll explain to that person that voting helps you be respected. Because oftentimes, not oftentimes, most of the time, people in lower income communities, black folk, white folk, Latino people, most of our patients were African Americans and still are. Uh, if they don't have a lot of money, they aren't respected. And matter of fact, if you do have a lot of money, you're still not respected as an African American. Hello? We have found that to encourage our patients to exercise that constitutional right that is there for people in America to be able to be heard. Oh my goodness, that made a difference. And not only that, check this out. We have then, my husband and I, and even now, express the desire to incorporate our patients into the mainstream community. We have them, encourage them to go to city council meetings, county council meetings, school board meetings, and other community meetings, and not just say, okay, I want you to go to the school board meetings. We go ourselves. We have to set an example for our patients. And when we have gained that respect, respect is a big thing. You can't, you, me, or anybody else cannot convince anybody to do anything unless there is a level of respect for you. If they have the respect for you, you have respect for them. And through that respect, and they know we're passionate about voting rights and civil rights and human rights. And with that respect, we find that we have been successful in getting our patients to register to vote, and not just register, but to show up at the polls. That's the big thing. Hallelujah. You can register thousands of people, as a matter of fact. I personally, over 12 years, 12 and a half years, registered 7,200 individuals. Okay, 7,002. I look back, I said, how in the world did I do that? Most of whom were pretrial inmates at our local jail. However, hundreds of our patients were unregistered, and a vast percentage of them, if South Carolina had its way in 2012, um, those patients would not have voted. Why? Because they didn't have government issued photo ID. And my husband and I spent tens of thousands of our dollars out of our pockets by the grace of God, hiring lawyers to go to family court over and over and over again for hundreds of our patients in order for them to get birth certificates, amended birth certificates, delayed birth certificates, in order for them to qualify for photo ID from the Department of Motor Vehicles. So I'm very verbal, and I'm going to cut it short because I'm sure you have other questions. But in our practice, it's very unusual, I would think, that we focused not just on the patient in the office, the patient in the hospital, which we hospitalize thousands of people in 32 years, but we go far beyond that into the community. And when you go into the community with passion and seriousness and dedication and devotion to people being treated right and having their rights, oh, please, the effect is unbelievable, uh, as far as raising people's uh, feeling of self pride and self respect.
Thank you so much. It's really incredible to hear about the impact that you and your husband, as just two individual people, having on your community broadly. It really, I think, speaks to the power of being active in your community.
Yes.
So, one of the kind of points that we want to make in this podcast is that the American Medical Association announced that they consider voting rights a social determinant of health. And we want to help our audience understand what that means. So, to start, could you explain what a social determinant of health is?
Yes. Health in and of itself is what the human body, the longevity factor, and how long you live, uh, envelops a whole lot when you think about who that person is, where do they live, in what circumstances, under what circumstances do they live. When one, a medical person, a physician, I talk about physicians because we are physicians. My husband specializes in internal medicine, geriatric medicine, and medical directorship. I'm in family practice. And when we actually got in our cars or truck and drove to where our patients live, that's real medicine. That's real medicine. When you drive or walk or skate or crawl or swim or however you get to your patient's residence and see where they live, go during the winter and feel the cold air seeping in through the cracks in the walls. Then you look at the children in the home who need to do homework, but yet they can't do homework basically because there is no light in the house. You ask, why is there not light? Because oftentimes they live in mobile homes over 20 years old. The wiring is defective. They have house fires, so they move from place to place, and hopefully no one got burned up in the fire. And we've seen some instances of that. People get burned up in house fires because of faulty wiring in substandard houses. But anyway, I said all that to say this. social factors are so very important. We ask the question, why is it? When you're talking about people voting, we want them to express and exercise their right to vote. However, they're going to put that on the back burner when they are trying to find out how they're going to pay next month's rent. They're going to put voting on the back burner when they don't have running water and have to go down the street to their neighbor's house and carry a bucket of water from their neighbor's house back to their house. They're not going to think about voting. They're going to not think about voting so much if their social environment ignores them as human beings. We had to go in at the elementary level. You're talking about voting. You just can't go into a situation and environment like that, an impoverished community. So, okay, all of y'all that want to vote, register to vote, y'all can come over here. I'll fill out the paperwork. Are you kidding? They don't understand about what a primary is, a general election, a runoff election, those kinds of things, basic information many people just don't have. So you have to start at ground level. We bought United States U.S. Constitution books at $2.99 a piece. We bought thousands of them, thousands over the years, and we took them to the jail. Had to encourage the jail supervisor. Can we give these inmates these books? Because the preachers from the local churches come out here and hand out Bibles all the time. Why can't we hand out books on voting rights? Okay, we had no problems when we brought up those kind of things. Okay, and actually, many of the inmates couldn't read, so we had to I gave them homework. I said, okay, I tell you what, we're going to go through the first 3 pages. I'm going to be back in 5 days, and we're going to discuss what voting rights are about. They said, who do you vote for, Dr. Williams? We don't even know none of these people. Who you voting for? I said, well, I can't persuade y'all to vote for who I'm voting for. You vote for the people who you think will help you and your family. They said, how are we going to do that, Dr. Williams? Well, that was a good question, basically because in the jail, the televisions were on EPS or whatever, the athletic station. They wanted to look at the ball games. They wanted to look at all kind of stuff, but the news wasn't on. I said, whoa, 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 whoa. We have to have these individuals, men and women. Some of the women were pregnant even. Some of the women were in the jail with their mothers. Believe that or not. I said, okay, I tell you what. We're going to have CNN, MSNBC, Fox News, what have you, at least 30 minutes to an hour a day in the jail. Mandatory. Let them, those incarcerated people, see what's going on in the real world. They're going to be released in a little while. See what society, what their communities are about. Lastly, and I'll let you go on because we'll be here for, for the next 45,000 years and I'll still be talking. Listen, the jail, and I take my hat off to the guy, the supervisor, the head guy at our jail, who was so welcoming to us coming in talking about voting. Um, every day I was out there to that jail every day, including weekends, registering folk, even in lockup, people who were violent people who were in cages. I call them cages. And we were able to sign them up. And they were interested. I go in singing, letting them know we care about y'all. I said, what song y'all want to hear? They said, Dr. Williams, sing Jesus is on the main line. Tell him what you want. And I'll go in and sing. I said, Jesus is on the main line. Tell him what you want. And they'll come to the doors. They have a little window that they can peek through. What? So you talk about society. How does that affect medicine? These men and women had medical problems, yes. Seizures, high blood pressure, heart disease, AIDS, cancer, you name it. The environment that they live in, you name it. Most of them were low income. And so you take all of that and envelop it. If you really want people to express themselves, feel good about themselves, feel good about America. America hadn't been so nice to black people. We're still fighting for voting rights. Uh, Yet a whole lot of attention is going to other countries and billions of dollars, and black folk are still having to fight for voting rights. Still in the midst of all of this. And so I said all of that to say this. As a physician, we have an obligation to our patients to go way and far beyond that medical practice into the community and show our population of people who are out there struggling. Uh, when we put them in home, we gave away about 6 homes in the past 12 years. Just fix them up, abandoned homes, fix them up, bring them up to today's standard, and just give them to folk, okay, who had families with no grant money, with no grants. Okay, but we have some very nice friends, very good friends who've given us some funds. Okay, now, so when you ask the question about society, how do you get folk in society to uh, want to know about voting? And how do you get them to vote? And I asked people in the community as well as the jail. The jail was a mammoth effort. But I always put it to the inmates like this. If you don't want to vote, if you think voting is not important and you don't want to vote for yourself, if you think voting doesn't help you one iota, vote for your children. Look out for their future, okay? And money's going to education, universities, colleges. Come on, y'all. Don't you have some desire for your family, your children, your grandchildren, nieces, nephews? And that hit a nerve with many of the inmates. Many of them. They said, yeah, doc, you're right. You're right. You're right. Okay. And we were able to register them by the thousands.
As we're talking about voting rights being a social determinant of health, in your community, have you seen some of the pathways of how getting someone registered to vote, getting someone engaged civically and politically has impacted their health? And you've talked a bit already about kind of the psychological and psychosocial effects of feeling like your voice is being listened to. And then there's also the ability to vote for specific policies that could benefit your health. Could you talk about some of those pathways of why voting could improve your health?
Let me bring it to something even more recent. When COVID hit, coronavirus pandemic, uh, and so many people were dying, we took care of many patients who had COVID. Matter of fact, my husband was the first physician on our hospital staff to come down with COVID. My husband, then after he got over it, then I came down with COVID. Okay, that was back in 2020. Opened up a free clinic. We opened up a free clinic about 2 weeks before COVID hit this area, and the whole area shut down. Uh, Having that pandemic come through, and then the Treasury Department under President Biden had dispensed several billions of dollars. It might have been $30 billion to spread across America to every county, every city, that was affected by the COVID pandemic. I mentioned to you that most of the expenses that we've had, my husband and I, our organization, the family unit, which is just a little handful of us, about 5 people. But anyway, when I found out that Sumter County, that's where I live, Sumter County, and the city of Sumter were getting millions of dollars for COVID, I said, oh my goodness. We have to try to get some of that money to help some of these people who live in mobile homes where the roofs are caving in and the ceilings are falling in. I have pictures, been in folks' homes, put them on my Facebook page. Floors caving in. Folk falling through the floor and breaking their leg and stuff have to go to the hospital and have surgery. Okay, listen. Folk with no running water, the septic tanks break down. I said, oh, Lordy, have mercy. I got a phone call from one of the politicians in town. Because everybody in town know Joe and Brenda Williams spend their own money. Okay. One of the politicians said, Brenda, listen, don't use my name, but Sumter County is getting $20 million from COVID, American Rescue Plan Act. I said, what? He said, yes, ma'am, 20 million. Plus the city of Sumter is getting 10 million. He said, apply for some of that money, Brenda. He said, you and Joe spend your money. Apply for some of that money and help those indigent people. And man, I went to town. Whoa, I go to the city council meetings anyway, county council meetings anyway. And I told them about these indigent people in these houses with roofs caving in, such and such, such and such, and they come through our free clinic. Many of them are long COVID sufferers, etc., and they have high blood pressure and so forth and so on, and lung disease from inhaling all of those funguses, etc. And lo and behold, I got some of the patients to come in. Many of them were shy. Again, I always say, okay, you want me to help y'all? Okay, you have to get registered to vote. I said, oh, yes, ma'am, I'm already registered. I said, when the last time it was that you actually voted? Well, about 4 or 5 years ago. I said, well, you're going to have to register again. I said, you see, this money that's coming through, millions of dollars all over the nation, comes as a result of some political stuff going on. Like in D.C., where these congressmen get together, the president and the Treasury Department, you have to explain this kind of stuff. And they have sent money. This is money, what? And we were lucky enough to get $15,000 from the city of Sumter and 15,000 from Sumter County. And boy, that money went. In a month, that money was gone. You say, how did y'all spend up all that money? On hiring electricians and carpenters and plumbers, and about 8 families put new roofs on their houses, wired them electrically, bringing them up to codes, plumbing, and the money went. Okay, now check this out. So that money dried up last year. Nobody got money. And other counties were calling. They said, Dr. Williams, we hear that y'all in Sumter get mobile homes fixed up with some of that COVID money. I said, yeah. I said, but it can't come from Sumter because you live in Lee County. And I told him, I said, see, you have to, are y'all registered to vote? Yes, ma'am. I said, okay, good. I said, I tell you what, because see, that's how that money is coming. That money is coming after voters have gone to the polls and stuff. See, and so you relate that, you tie it in. If they see some connection, it's like a carrot before a horse. You see what I'm saying? And you're talking about human beings, but they want to know what's in it for me. You say you want me to go vote and stuff. What's in it for me? What's in it for my family? How is that going to help me? It's psychologically healthy when somebody wants to help themselves. Oh, it's psychologically beautiful. If you are passionate enough about something and you feel that it's right, do it. They might lock you up. Do it. And the children who we are raising, grandchildren, etc., will see that passion, See your commitment, see your dedication, and teach the children, oh my goodness, teach them the importance of the ballot. Teach them the importance of let your voice be heard. Who you're voting for might not win, whatever, but you express your opinion. And when a person has a voice, when a person is given a voice, oh, that's powerful.